Hi, Dr. Berveen. I hope you're fine. I will talk about the history of pharmacy. I hope that you will enjoy with me. First of all, the word pharmacy derived from the Greek word pharmakon. This is the origin word, which means medicine or drug. Greeks are the first discoverer of profession of pharmacy. In the past, pharmacists were known by names like alchemists, compounders, and apothecaries. Here's the outline. Materia medica that I will talk about. Then the periods of the evolution of pharmacy. Uh, First, ancient era, the beginning of time, to the beginning of time of after birth, the 1600 after birth, and then empiric era, 1600 from 1600 until 1940, and then the industrialization era from 1940 until 1970, then patient care era from 1970 until now, biotechnology and genetic engineering era, the new horizon, then apothecaries. Materia Medica is a book. It's a book by Greek physician. It helped a lot as a basic reference for other medical books. The term nowadays replaced by the term uh, pharmacology. This book made a huge impact and progressed. And here, as you can see, some of the pages of the book, and some of them are translated in Arabic. Ancient era. As we have studied, that the early man used materials in his surroundings like leaves, mud, and cool water that used to stop bleeding and heal wounds. Then the empiric era. The empiric era, the main contribution of pharmacists to science was in the domain of chemistry in this era, which they made a big differences. So they identified new drugs and chemicals. Benjamin Franklin started the first hospital in 1751, and the first hospital pharmacist was Jonathan Roberts. Then the industrialization era. Here in this era, more people needed drugs for injuries and illnesses from the wars. So mass production of medications were made through industrial machines. Uh, and then next, patient care era. The patient care era. There is a negative side in this era. New problems and complications like allergic reactions and multiple drug interactions with other drugs and food. On the other side, the therapeutic duties and their own responsibilities of patient care was increased, which is a good thing in the pharmacies and hospitals. And then biotechnology and genetic engineering era. Biologically, here in this era prepared products such as complex chemicals, synthesis, and increased use of parenteral medications were all part of this period. Art of apothecary. First, here uh, in the art of apothecary, the word apothecary is derived from apotheca, meaning a place where wine, spices, and herbs were stored. So, the art of apothecary is that mixing of compound according to the specific health needs of patients. And here in the slides, in ancient China, where the medicinal values of herbs were tried to discover and investigated. During the latter part of the 8th century, the first apothecaries and apothecary shops appeared in Baghdad. These streets market shops sold medicines along with syrups, perfumes, and wines. Today, the pharmacist is primarily a dispenser of drugs already formulated and manufactured by pharmaceutical companies. So, the modern pharmacist also referred to as a chemist in British English. Then these sites I searched. Thank you for listening.